Very good evening. I'm Srikanth. I'm the head of operations for AyurUniverse. We are India's largest wellness portal, offering preventive wellness, ailment management, online and signature programs in yoga, Ayurveda, and naturopathy for global customers since 2016. We currently host more than 300 wellness centers and authentic hospitals in India and abroad, with a large presence in India, Sri Lanka, and Nepal. We are also planning a global presence in the coming years. Customers from more than 65 countries have booked their wellness programs through us. We are approved by Department of Tourism Karnataka, Incredible India, and member of a Global Wellness Institute, California. Today, we are bringing you a live webinar in collaboration with Illom Ayurveda, the topic being Management of Autism through Ayurveda. Illom Ayurveda Hospital. Illam means the traditional homestead of Kerala Brahmins. Illam stands for a serene abode of holistic healing. Illom Ayurveda is an authentic and traditional Ayurveda treatment center which gives personal, homely care to patients since many generations. Pallipattu Illam is a Musat family home situated in Kerala, having a tradition of more than 700 years. Followers of renowned scholars in Ayurveda like Tripangod Parameshwaran Musat, the first Vaidyaratnam awardee, Tirunavaya Sankaran Musat, Vaikam Pachu Musat are from the Musat family. Musat family is well known for their divine hands of healing. The ecosystem has complete set of 27 bird star streets, 5 traditional ponds, heritage rooms, Sarpakavu, the sacred serpent grove, and 300 plus rare medicinal plants. Illam is a Kerala government approved Ayurveda center and olive leaf certified. Today we have two eminent panelists amongst us. Dr. Musad is an Ayurveda physician and a medical director for Illam Ayurveda, has more than 12 years of experience, belongs to the Pallipattu Illam family of several traditional Ayurvedic healers, has worked as a deputy physician in Kottakkal, Arya Vaidyasala Kottakkal, one of the leading Ayurveda hospitals in the country, consults with several renowned Ayurvedic centers across the country, has extensive experience in Nadi Pariksha. His fields of interest include Nadi Pariksha, Ayurvedic approach to autism spectrum disorder cases, Panchakarma, and thyroid cases. We also have Danesh Kumar, a qualified speech language pathologist. He is the chief consultant and rehabilitation specialist at Illam Ayurveda, a qualified audiologist, has a fellowship in neurological rehabilitation, has more than 10 years of experience in the field of disability rehabilitation, especially in areas of disability assessment and diagnosing, planning and designing of total rehabilitation, awareness generation, and parental training, and so on, has different levels of qualification in alternative therapy. With that, let me invite Dr. Musad to start the discussion. Doctor, before asking any questions, I just want to, on autism, I have a question for you. What is this bird star tree? Can you just explain about that? I'm a little curious to know about that.
Okay, very good, very good. You have stricken that birth star trees. It's nothing but we are having some relation with our everybody having a star of ourselves.
Okay.
So it's having a relation with our nature. Every star, every person is a link having with the nature's tree or plants or animals, whatever the living beings may be. So each and every person is having a link between the trees. So we can take care of that plants. Along with that, we can take care of the nature also. Actually, in our autism related treatment also, that is one of the concept in the treatment aspect also.
Okay, doctor. Okay. So the first question I have for you is, doctor, what is autism spectrum disorder?
Okay.
And what are the symptoms?
Okay, it's a very general question.
Yeah.
But the thing is, the answer, we can say it in two ways. In the sense, the very first thing is we can say it as theoretically, what are the symptoms? But in actual scenario, the symptom varies from 0 to maybe more than 100. So theoretically, when we say there are 3 typical symptoms of autism spectrum disorders or mere autism, the very first thing is communication challenges for the kids. They are not able to communicate to others. The second one is the repetitive behavior or repetitive speech is a typical symptom. The third one is the poor eye contact. They will not have a proper eye contact with the object in front of them. Even if it is a living being, also they will not have a contact with them or eye contact with them. These are the main specific symptoms. But in our experience, since more than 10 years, we came to know that only these symptoms is not the proper diagnostic criteria for autism spectrum disorders. Like maybe the parents may be telling about more of speech delay or speech difficulty to speak, or hyperactivity also may be included in that, or that learning disability also may happen, and some psychological issues like they will not have any emotions, like they will be unaware of the emotions of others, like sadness, happiness. They will be devoid of all the emotions from the surroundings. Even that also is seeing or presenting complaints will be there. So there are a number of symptoms in autism spectrum disorders to classify or to score the kid. How is the kid right now?
Okay. Um, so, so you mentioned there are two aspects. One is a theoretical aspect and a practical aspect. About theory, you said challenges in communication and repetitive speech and maintaining eye contact with live and non-live objects.
Yes, yes.
Also, you spoke about delay in speech, hyperactiveness, learning disability, and also not able to relate to emotions of the people around them, right? So,
Yes, yes.
doctor, tell us, is there any specific reason for this?
Okay. Because that question right now, if you see in the internet and other things, the cause is unknown for us.
Okay.
Even for science, the cause is unknown. But I'm not relying on that unknown cause, because if a cause is not known, that means the treatment is not there. We can just manage it, because many people will ask the first question whether it can be managed or cured. Because if the cause is known, we can cure the disease. If the cause is not known, we can manage the disease. That's why even for diabetic and hypertension also, if the cause is not known, it can be managed till your lifelong. But if the cause is known, we can treat the basic cause. So coming to your point, the cause for the disease. So since this many long years we are treating these kind of cases, we have come to a conclusion that the cause is ultimately the gut metabolism, as the digestion and assimilation of the food particles, how it has been. So that I can just explain within 2 3 words. Our body or our stomach or intestine is having two kind of bacteria in our stomach. The one is good bacteria, the second one is bad bacteria, or good microbiota and bad microbiota. This is ultimately scientific. So whenever our good microbiota is not proper, or the number of good microbes in our body is less, at that time any kind of toxins, any kind of preservatives, any kind of heavy antibiotics, any kind of some kind of vaccinations also. I'm not saying vaccination is the cause, but if the vaccination is given when the gut microbiota, good microbiota is less in our body, that will hamper our stomach. And there is a study called gut brain axis. There is direct relation with gut and brain. So when the gut is impaired, these toxins from external things come to our body. So our body is not able to tackle that, because our good microbiota is the one to do that. So if it's not doing, that will affect our brain. That's what happening till, because 95% of the cases the parents are saying that till 1.5 years, 2 years, the kids are normal. They were talking to us, they were responding to our stimulus, they were very what we say nearby to us as emotions, but immediately they have lost everything. So that is not genetical factors, 5% it will be there. But as per my point of view, it's not at all genetical. 95% it's not genetical. 5% it may be genetical. That 95% it's main cause is the gut microbiota, impairment in the gut microbiota. So the treatment also we have to give the same. I'll come to that afterwards.
That's very insightful, doctor. So what you said is was very interesting. You said if a cause is unknown, you can only manage. If a cause is known, then it can be treated. And it is so what should I say? It's an insight for me saying that the gut, the imbalance or the impairment in the gut microbiota is the root cause for ASD, and that is news for me. You also said that it's 5% only genetical and 95% is related to the gut biota. That's news to me.
Yes.
Okay, so let me invite Mr. Danesh to come in and answer this question.
Yeah.
So Danesh, can you let us know what are the diagnostics tests required to confirm a child is autistic or not?
Actually, there are so many tests are available. Before that, we should know the process of analysis, because this is assessment or maybe the confirming an ASD is a process of assessment is required. It starts from maybe we can say it's starting from the interview with the parents. Basically, starting from the interview with parents. The second one, the observation of the child's behavior. The third one, we have to follow some criteria. There are so many criteria available in the globe. So we have to follow the criteria for assessing the parent as well as the child's behaviors. The fourth one will come to the assessment tools. I'll tell you, because mostly the parents will be coming maybe with the complaint, as Dr. Musa said, they will be coming for speech language deficiencies. They may say that the child's speech is affected and he's showing some kind of behavior problem. That's all their complaint will be. So from there, we have to interview the parents, different situation, how the child is behaving at home, how he is reacting to an activity, how he is doing his coping with his ADL skills. Everything will be discussed. Interview. It's a detailed interview is required, first of all. The second one, the same time, simultaneously with the interview, we have to observe the child also. How the child is behaving at the clinical situation, first of all. The clinical situation analysis is the first-hand information we will be getting. And also, we should observe, we may ask the parent to get some videos, how the child is behaving at home. Same time, we will let the child to behave outside the clinical side also. It takes hours and days, maybe sometimes, for the confirmation. The second stage is like that. The third, we will, during this interview as well as the observational analysis, what we do, we always follow the diagnostic criteria. Basically, DSM-4 criteria, DSM-5 criteria, or ICD-10 criteria. We will follow the criteria. We know the criteria. So when we interview the parents as well as observing the child's behavior, we go through the criteria. That the child is maybe attaining that criteria or not. That will be discussed. And the fourth one, after the interview and observation and following the criteria, we will go for some diagnostic tests. It may be after 3 or 4 days, after observation, interview, everything. After 3 or 4 days, maybe sometimes we'll start the therapy before doing the assessments. Sometimes because the parents won't say the exact, maybe the parent is not noticed anything. So the parent will bias our analysis. So we will keep the child for therapy for at least for 3 or 4 days. After therapeutic intervention, only we'll go for some kind of assessment tools. All the assessment tools are all maybe related to diagnostic criteria. So basically, commonly available diagnostic tools are Autism Diagnostic Interview, one of the ADI, we say it is ADI. Another one is Autism Diagnostic Observation Schedule, ADOS, we say ADOS. The third one is Childhood Autism Rating Scale. We say it is CARS. And then another one is William Autism Rating Scale, which is called GARS, GARS, GARS. And the fourth one is the Indian government has developed one test tool called Indian Scale for Autism Assessment. In Illom and my practice, we usually CARS as well as ISA. Indian Scale for Autism Assessment. CARS is Childhood Autism Rating Scale. Both the scales give us the rate of autism as well as the major components. So we follow CARS as well as, and other tests is also common. MCHAT is also, you might have heard of MCHAT. It's a modified checklist for autism in toddlers. It's on another kind of test. It's global. It is using worldwide. That also we sometimes use for confirming autism. Maybe 1 or 2 tests will be doing. not only one single test, we won't depend on single test, we might do one or two. Basically, CAS as well as Indian scale for autism. These are the test tools which we follow for confirming autism. But it's not dependent only on test tool, it's with parental interview, observation, following the criteria. The fourth one only is the test tools which we use. Because there is no other way. We can't do any MRI or blood analysis, nothing like that. This is actually it's a behavioral disorder. We have to depend on the behavioral observation. So these are all checklists. Don't think that these are all some kind of maybe blood sampling, nothing like that. These checklists are all checklists. It's a paper pencil test. So we are depending on paper pencil test for confirming autism. That is one of the present scenarios like that. Where we might get some kind of other development soon, but presently we available only checklist of paper pencil test. This is what.
Okay, Mr. Dhanesh. So what I understood is that there's a detailed process for analyzing, basically diagnosing. You said first you interview the parent just to understand what the parent is saying about the child, and then you get the child and observe the child live, what is happening in the child, and then you also spoke about some other criteria, and finally the assessment tool. I mean, you also give a list of lot of assessment tools. The interesting thing that you said is, so it may take hours or maybe even days to find out what actually is the real reason, real diagnosis, right? Okay, so Dr. Musa, we already spoke about managing and treating. You gave a nice explanation. If you know the root cause, then you can treat. If you don't know the root cause, you can only manage. So can you please tell us what is the role of Ayurveda in this, whether it can be cured or managed?
If you are asking for a single word answer, there is no answer for that.
Okay.
Because for the treatment of autism spectrum disorders, it need many things to be helpful or into the stream for that. So your question was whether Ayurveda can manage that. So frankly speaking, only with Ayurveda, we can't do nothing. As an Ayurvedic doctor, I can say purely for that. In the sense, only with Ayurveda, we can't do any change, because it's not like any other condition or disease. There is a dispute between these two also, whether this is a condition or this is a disease. For that also, the first answer was apt. When the science has come up with a medicine for autism, everybody will call it as a disease. Till now, there is no medicine for this. So everybody is calling it as a condition. That's my answer for that. So for any other disease, we may have to give some of the medications for rheumatoid arthritis or any kind of headache. We can give, as a doctor, we can give some medications and that will be cured. But in this case, only with Ayurveda, we can do nothing. But the thing is, we have to do the symptomatic relief as well as the root cause for the disease. That's why I told that gut metabolism, that is the main root cause. Gut metabolism is the root treatment for this. And the cause for this is gut microbiota, impairment in the gut microbiota. That's why in Western countries right now, they have come up with a concept called prebiotics and probiotics. It's nothing but increasing the good microbes in our body. Live microbes, we are taking it inside through this whatever buttermilk or yogurt or something like that, that's having probiotics. The other one is they are giving food as a fiber-rich food to these microbes in our body. So it's nothing but correcting our gut microbiota to treat this disease or this condition, whatever it may be. So Ayurveda can do the gut metabolism in the root cause. And for other things, the receptiveness, because whatever we are seeing is the sensory aspects will be there. Some kids will not hear whatever we say, or they will not having any relation with the external stimulus. They are in their own world. They will play like they are not having the surrounding relation will not be there. So first of all, we will think that whether they will have any defect in their sense organs. Everybody will go for a ear checkup, tongue checkup, or the skin checkup. All the checkups will be okay, and the sense organs are okay for them. And whether we can see any defect in the MRI or any CT scan, that also will be normal. So what is happening in this case? There is a relation between our sense organ center in our brain and the sense organs. There is an impulse passage happening in between that will be in fraction of seconds. So usually I used to explain this case as this kids, our mind is having three qualities. The very first quality is dhi, dhriti, and smriti. Dhi in the sense the intellect. Dhriti, the second one. The third one is smriti in the sense memory. So first one is intellect, third one is the memory. They are in lagging of the middle one. That is nothing but the cognitive or common sense or whatever the intellect and memory, where it should be placed properly. That is lagging in them. So whenever we go for any intellectual examination or any memory related thing, they are very good in that. Nothing. 99% of the kids are very good in intellect as well as memory. They are lagging in this dhriti concept. How to place, when to place, that is lagging. So we are trying to put that into a stream. For that, we need many things to be done prior to that. Maybe the kids' parents will be saying only speech delay will be there. Other things will be okay. Some say that speech delay, hyperactivity, whatever, the old symptoms also will be there. Even if in that condition also, the line of treatment that we are introducing will be the same. Only thing the medications will be, or the intensity of the medication will be the difference will be there. So we have to correct the gut with Ayurvedic medications. That too, we will not prefer any kind of Ayurvedic medications with preservative also, because that also will harm the gut of the kid. So gut impairment has to be corrected. Whenever the sense organs in the brain, that receptiveness should be okay. We know that when we keep our finger in front of lamp, immediately we will just pull it back. How it happens? An impulse is coming from the fire, goes to the brain, and brain gives the sensation that just pull it back. This is happening in a fraction of a second. But in the kids, they may not have that sensation, or they will not recognize that sensation. So that has to be corrected with gut metabolism. I will just explain whatever the treatment modality is needed for the kid detailedly after. One or two questions I will just explain. I think that has to be corrected first.
Good. Very good, doctor. So you said, yeah, only with Ayurveda it cannot be cured. If it's ASD, it's a condition and not a disease. And you also said in the Western medicine they are taking an approach by still working on the gut. You spoke about prebiotic and probiotic. Interesting thing that you said is that there are three attributes that you mentioned about the intellect and memory, and you also gave a nice example. When you touch the fire, immediately the signal goes and we just respond to it. A child with ASD, there is a delay. That's what I understood, and it all comes from the gut. Yeah, so you said the gut needs to be corrected, and when you also do Ayurveda treatments, you can't give the patient food, Ayurvedic medicine or food with preservatives, because that also is not going to help.
Yes.
Good insights, doctor. Mr. Danesh, I have a question for you. What is the role of multidisciplinary therapies in this regard? Danesh, can you hear me?
Yeah, please.
Yeah. Can I repeat the question for you?
Yeah, it is without doubt we can say it's one of the leaders. Yeah, yes, I think. Hello.
Yeah.
No need. I heard your question. Do you feel any delay?
Yeah, there's slight delay. Yeah. Anyway, carry on.
Okay, it's something, and I heard that how the role, it's, I can without any doubt I can say that there is a crucial role, maybe a leading role in management of autism, because as Dr. Musa said, it's alone. Only Ayurveda is not a solution for autism management. There is something is also required. He may be explaining in later time, maybe about other aspect of autism intervention along with Ayurveda, what all is required. Maybe so one of the important, along with Ayurveda, one of the important treatment required is multidisciplinary therapeutic intervention. Multidisciplinary therapeutic intervention, actually, it starts from, already I said that, it starts from the interview. Same way, here also it starts from the assessment. We have to have a detailed assessment. And you maybe remember that, in the initial stage of maybe the interaction with Dr. Muther, he said that the triad of autism spectrum disorder, one is communication error, the second one is social behavior, maybe the eye contact deficiency in eye contact, his stereotyped behavior. There are a few things he has explained. So we have to analyze each and everything. He explained in a different mode, that gut theory he has explained how this is happening in maybe through Ayurvedic perspective. He has explained in a different way. The same way, we will also have some kind of assessment, how the communication is affected, how much the communication is affected. Is it a delay or a deviation? Delay, sometimes the delayed communication or sometimes deviated communication, both can happen in autism spectrum disorders. That to be assessed first. The second one, what we do is our behavior analysis, how severely affected. Each and every symptoms will be analyzed, and how severely it is affected also we will be assessing. And the third one, how the sensory modality is acting, how the sensory processing problems are happening in the child. That also we will be assessing. The level of sensory issues, that should be assessed. The fourth one, what we assess is the parenting, how the parent is involved in treating the child, or how much the parent is aware about the condition, how much the parent is involving with the child's intervention, everything. The same way, we will also analyze how the educational skills, maybe the child is at the age of school age, we might analyze the educational skills, the attention, so many factors will be assessing initially. The second, what we do, we will categorize the child. Categorization means the severity, based on the severity of the problem. Already we diagnose the child as autism spectrum disorders. We will categorize the child, whether the child is mild or moderate or severe or profound case. Like that, we will be categorizing the child based on the issues, which are through the analysis we will be categorizing. And the fourth one, the last, we will do the treatment plan. Treatment planning is, not simply, we are just simply planning therapy, is not like that. I'll explain in later, after this discussion, I'll be explaining about how we can combine the therapies. And now about, the role, what we can say that speech therapy, for communication errors, we need speech language therapy. Behavior problems, the basic problem with autism spectrum disorder is behavior. So we need behavior modification or applied behavior analysis therapy. The third one is the sensory modalities are affected. Sometimes the child's sensory issues are hyper or hyposensory issues can be there. So we have to normalize the sensory modality. So we need sensory integration therapy, otherwise occupational therapy. Sometimes we need education intervention, like special education or education therapy, like that we need educational intervention. Parental intervention is required. And family therapy, like sibling therapy, like there are so many aspects of intervention is combined here. So we can't, the role of multidisciplinary therapy is something, we can't, there is no question. It is the important thing for the intervention, along with Ayurveda. Not only with Ayurveda, we can, along with Western medicine or homeopathy, Unani, any medicine we can combine. But in my, maybe in my experience, I have combined with so many interventions. Our multidisciplinary therapies are combined with so many other mode of intervention. But I feel that Ayurveda is the one has its own strategy to handle ASD. So when we combine our multidisciplinary therapeutic intervention with Ayurveda, the result is so high. Maybe why this is happening, and that everything will be discussed in due course. Maybe Dr. Musad will be explaining how Ayurveda affects child's intervention or improvements. But I say, with my experience, last my 1.5 decades of experience, I can say that along with Ayurveda, multidisciplinary therapy is one of the important thing. And only with multidisciplinary therapy also we can handle autism. But when we combine with Ayurveda, we can give more results than maybe the team is working for maybe the management of autism. That is how I can explain how the role of
Thank you, Mr. Danish. So you spoke about multiple therapies. You spoke about therapies around communication, around behavior, sensory modalities, and also therapies with parenting. You also spoke about different types of different categorization of the ASD: mild, moderate, severe and also you said profound. So that means like it's like it's something more intense than the severe condition. The interesting thing that you said is that yeah, all these therapies combined with different um, different types of wellness systems like Ayurveda, Unani, and homeopathy give better results. And in your experience, you feel that if you combine that with Ayurveda, the results are much better. Okay, thank you so much,
Exactly.
Mr. Danish.
Yeah.
Dr. Musad, can you tell us what are the factors in treating ASD? You need to unmute, doctor. I'm not able to hear you.
Shall I?
Yeah, please.
Okay. So as I told before, there are many factors in treating this ASD case. Right now, since 4-5 years, we are sticking on these factors to treat ASD. In that, the very first thing is the ahara. We have made a protocol for this treating ASD also. That we have named that protocol it as Ashtanga Protocol. It's merely available or made up at Illom. The first one is Ashtanga, in the sense, ahara is the first thing that has to be corrected. The food that goes inside is treating our kids than any other thing. Because we know that if we take more spicy and more sour food, that is making what kind of change in our mind just after 24 hours of digestion. In the sense, our mind also will be somewhat perplexed, or maybe tension will be there if we take more of spicy things. So that means the food is having some role in our mind and in our body. Our body will be more heat generated after taking all these kind of spicy, sour, and fried items. And right now there are advises to exclude gluten, dairy, and the milk products, whatever it may be. So these are the food habits right now the patients are following. But other than that, many things are there, and these two things why we have to avoid gluten and dairy. The protein rich food is not able to digest in the intestine, so that protein metabolism has to be corrected. So after correcting that protein metabolism, we can take all these gluten and dairy items. It's not like lifelong they have to avoid. So as per my rule and our Illum protocol, we are correcting the gut metabolism to correct the food absorption better. It's not like devoid of all the food habits till your lifelong. So the first one is ahara has to be corrected. What all things should be taken? The rajoguna yukta ahara. In Ayurveda, we'll say the more of rajoguna food that will cause hyperactivity and restlessness and all those things in our mind. So the kids will express that without any intention. As we people are having the ego, the self-knowledge, we will just see the surroundings and express our feelings. But for the kids, they don't want to see all those things. They just express whatever feeling is inside. The ahara is the first. The second one is the Satwik thoughts of parents. As Mr. Dhanesh ji has told, we are interacting with the parents to get the scoring of the kid. So it's in subjective and objective kind of experiment or analyzing the kid. So if the parent is having perplexed mind and whatever the restless mind, even that will cause the kid in the proper line of treatment. The parent should have the Satwik thought. The parent should have the what we say spiritual thought also. It's not like going for temple, going for church is not a spiritual thought. For example, I used to say that the cause of this is little bit of karma related. The karma of the parent also. That's why, so for some parents, they are getting the right line of treatment at the age of 3 or 4 years. For some parents, they are not getting the proper line of treatment. They are getting at the age of 12 years. So something is there driving them, whatever the knowledge that they are having. Even the doctors are also not getting proper line of treatment. So that spiritual thoughts or sattvic thought is the second one to have for the parent as well as for the kid. The third one is the healing hand of nature that we say in Ashtanga. The third one is healing hand of nature. What we have seen is when we make these kids to be with the nature, they are showing much tremendous change in them. In the sense, we are doing farming for them. We are giving them barefoot walking. Some water therapy will be there. So all those things are making them calm because they are restless and hyperactivity will be there. To regulate that, doing the karma itself will reduce that. That's why sensory integration therapies in therapeutical way they are doing. So it's a kind of therapeutical sensory integration therapy which we are doing with the nature. So that healing hand of nature is very much helpful. The fourth one is the therapy integration. As Dinesh ji has told, the proper line of speech, behavioral, special education, all those therapies are having its own importance. The next one is the Ayurvedic interventions. That too, internal as well as external, it will be there. That Ayurvedic interventions, wherever you go, you may get. In the sense, internal, you should keep in mind that it should be devoid of any preservatives. It should not contain any kind of harmful materials. And external therapies like Palapotichil, the Dhara, even the Udvartanam, the Nasyam, all those things, whichever is needed for that kid, we may have to administer. So that is the fifth one. The sixth one is Nadi Shuddhi, that is through yoga and pranayama. Yoga means that children's yoga we used to teach the kids, as well as the parent also should do yoga every day, at least for 10 minutes in the home. Because the main quality of these kids is they will have repeating the things or imitating the things. That is a quality of autism spectrum disorders. So we have to give input to imitate the things. So what we are seeing is when the parents are doing yoga in the home for 10 minutes, indirectly it will come to as a routine for the kid also. So after 6 months, even the kids will do the yoga. Directly, if you are giving yoga to the kids, they will not do. So better make the life change in the home itself to do the yoga and this pranayam also. The other one is the gut correction and rhythmic living. During our treatment procedure, we used to say that we are correcting the biological clock, in the sense what time the kid should get up, what time he should take the breakfast, what time the lunch should be, what time the dinner should be, what time he should sleep. Maybe 80% of the cases, the sleep disturbance will be there. We are not giving any kind of medication for sleep disturbance. No sleeping pills, nothing like that. We just correct the biological clock because our body is having a clock. If we are going beyond that clock, the body will not allow us to live properly. If we are in the biological clock, body only itself will reduce or tackle it with the symptoms. The last but not the least, the art of positive parenting. In the sense, for example, if the parent is saying all the negative aspect about the kid, it's a tendency of the parent. Whoever comes to the home, they will say that he's like that, he will not do that, he is very restless. If we say 10 times the same thing, that quality will be there in your kid, even if it is not there also. So the parent should have proper knowledge how they should maintain the kid in the home. It's not like not giving all the things what he or she needs. As per our training, our main aim is to give whatever is unlike for the kid, because our aim is to have a long-term change, not a short-term change. We can give whatever the kids like. If he is liking more of idli, we can give daily idli, but it's not solving the problem. How it should be solved? If he is able to take all the things that he is not liking also, or the negative emotions, negative situations, if the kid is able to face that, that is the success. Not like keeping them calm by giving all those things what they need. So these are the things that we are taking care, this Ashtanga protocol, so that the parents are responsible for the treatment or the positive treatment. Ayurvedic doctors involvement will be there. Therapy integration should be there. Gut correction should be done properly. And the nature's tool, even if you are staying in the flat also, you can keep some grow bag and keep some small chilies or whatever it can be grown in that. That itself is a healing hand of nature. So we will teach all those things, what should be done in your lifestyle, wherever you stay. So these are the things that should be integrated in the line of treatment. And right now we are trying to incorporate the music therapy along with that also. We are in a scientific study with that, because many a times music, the ragas are helping much to tackle the emotions, mind related emotions. So that also maybe we are studying in that. So these are the things in the treatment line.
Thank you. Thank you very much, doctor. You gave a very detailed explanation about the treatments. You said Illom Ayurveda, you all have developed a protocol called Ashtanga Protocol, which is covering ahara, which is food, primarily to improve the digestive system. And you are in the beginning, you want to avoid gluten and dairy-based products, which is rich of protein and it cannot digest. So you are correcting that. And then Satwik thoughts or spiritual thoughts of the parents. And you also said about karma related and the healing hand of the nature, farming, barefoot walking, water therapy, etc. You spoke about the fourth one as therapy integration. Fifth one is Ayurvedic interventions like your Nasyam and Udvartanam and external treatments. You spoke about the Nadi Shuddhi, Yogasana and Pranayama. The seventh one was gut correction, correct the bioclock without giving any tablets. And the last one you said the art of positive parenting, where the parents have to keep talking positive about the kid than talking about the negative behaviors. The last one, then you also said you are experimenting right now how music can help in handling emotions of the child. Fantastic. I really enjoyed your response. Mr. Danesh, I have a question for you. How are the therapeutic interventions planned?
Okay, it's very good. Maybe Ashtanga Protocol is excellent. I also listening very carefully how he is planning everything. In that, one of the important, he explained that the therapeutic intervention is one of the major role it has. So here, it's planning of therapies is maybe based on the test results. Basically, with the test results, maybe we'll be after assessing only we'll go for the planning of therapeutic intervention. So we will follow the test results first of all. The second one is the severity of autism. I already maybe the last question I have answered that there is some kind of classification or categorization is there. Maybe like mild, moderate, severe, or profound, like that. Based on categorization as well as age of the child when the child is coming for therapy. The planning of therapy child is at the age of 2 years, the planning will be different. Like that, based on the age, at what age the child is coming for intervention. And the third one is the previous intervention. What all intervention the child had. The previous intervention in the sense, not only with the medicine I'm telling, what kind of therapeutic intervention the child was attending. Or does the child had any therapeutic intervention, or maybe some kind of therapeutic intervention is not required for the child. It's like that we have to assess the previous intervention. The another one is parental support. How the parent is supporting the child. Maybe the family members support is also will be analyzed. Otherwise, we have to give family therapy or parenting therapy should be added in the management. So we have to assess the family support as well as the parental support. The last one is associated conditions. Is there any other kind of problem like motor deficits or hearing or visual deficits or any other kind of associated epilepsy, like that? If the child has any other associated condition, that also should be considered when we go for planning. And the planning, when I'm coming to the planning, here we have the planning has two wings. The first wing is how the therapies are combining. The combination of therapies is the first wing. I'll tell you detail. The second one is quantitative therapy or the frequency of therapy. How many therapies, like that. The combination of therapy simply says, for a child, for example, for a child with autism at the age of 3 years, recently only the child is detected with autism spectrum disorder. The child is going to start the intervention. So the major concern of the parent will be communication deficit. No doubt the child will say that the child is not responding to my question, the child is not asking anything for him. So the communication will be the priority for the parent. Same time, the child is showing so many behavioral deficits, but the parent may not understand the problem. The parent accept that the child is
Dr. Musa?
Yes, yes, yes.
I
I'm
think
here.
we lost Mr. Danesh because his network connection was a problem, and also I was losing his voice a lot many times.
Voice. Okay.
Anyway, let me continue with you, and then when Danesh comes, I will ask that question once again, ask him to repeat. You spoke about the Ashtanga Protocol. Can you tell us, Dr. Musa, how long does it take for the treatment?
Actually, it depends upon the case.
Okay.
What we are doing right now is we'll just get the score of the kit, how much that impairment happened in the kit. Accordingly, it will take around 2 to 3 years with
Wow.
a proper line of treatment, proper diet restriction. It will take around 2 to 3 years. Why I am saying 2 to 3 years means we don't want to exaggerate the outcome. Before itself, the result will happen. But the proper we can see within 2 to 3 years. But in that time, it's not like, as I told, not only taking some medications of Ayurveda. That's why the first question I told that only with Ayurveda we can't do anything. Because unless until food is corrected, medicine will not work properly. If food is corrected, even medicines are also not needed also. But in this case, we need to have the medications and all those things, that 8 things that I have told, Ashtanga Protocol, and I have told about that positive parenting. I'll just explain one more line along with that. But I told about the karma. I have seen many change in the parents. When I said about karma, it's not like religious thoughts. Religious thoughts are different, spiritual thoughts are different. It's about the karma. They are facing all these difficulties. Mainly parents are facing the difficulty. So what I am saying is, whenever we facing any kind of difficulties, think that either we are studying something or we are reducing our karma. That is my theory. In the sense, unless until we face difficulties, we will not reduce our karma or learn anything. So in this case, the kid is the one which is helping for them to reduce their karma. That's why I am saying that take it as a God blessing for these parents, that they are the one who is making to reduce the parents' karma in that. So they are feeling more, what we say, attached to the kid. They will not curse the kid as the kid is like this. So make it as a chance to reduce their karma and be happy and go ahead. That is the main thing that a parent should need, because that energy in the home should be corrected first. So every time if they are cursing and they are blaming the kid, blaming the even the rapport with the wife and husband in the home also will affect the kid. That's why I told the energy in the home. If they are thinking about it's of blessing of the whatever the cosmic energy, that will have positive impact in the treatment also. If the home atmosphere is negative energy, that will affect the kid also. That's why we have put that art of positive parenting.
Thank you, thank you,
Okay.
Doctor. Now that Danesh has come back, I'm just going back to the same question.
Okay.
Mr. Danesh, we had a little bit of issues with your connection. Are you able to hear me, Mr. Danesh?
Yeah, sorry.
Yeah, so we
Yeah.
lost you, and also I think there was an issue with your...
I can.
So if you can just repeat what I understood, I just summarize, and then maybe you can follow. You can just continue. You spoke about categorization of the severity and the age. You spoke about previous interventions, parental support, family therapy, and associated conditions like epilepsy, etc. And you also said planning has got 2 components: combination of therapy and frequency. And then after that, I lost you. So if you can just go back, summarize, and then continue.
No, exactly. We plan, as you rightly said, we'll be based on the planning of therapy will be based on the severity of the condition, as well as the child's age, parental support, family support, associated condition, everything. Based on all these things only we can plan the therapeutic intervention. That is the one thing. For planning, we have 2 types of planning. 2 types in the sense 2 wings of planning. The first one is combination of therapy. So combination of therapy means, how initially we want to combine every therapy. That means, there are so many kind of therapies, like for autism spectrum disorders required. One is speech therapy, behavior modification therapy, sensory integration therapy, ABA, parenting therapy, family therapy. There are so many types of therapies required for autism intervention. But initially, based on these results or the analysis, we will be planning a minimum therapy initially, like maybe we'll start with sensory integration, behavior modification, as well as speech language therapy. This will be the first stage of therapy. That is a combination of therapy. Laterally, we will be adding parenting therapy or some kind of home therapy, some other kind of intervention will add laterally, based on the maybe the progression as well as the familial concern, everything will be considered during the progression. The second one is quantitative therapy. Quantitative therapy means how frequently we should give each therapy. Maybe we will be planning for a weekly basis only we are planning. Weekly basis and monthly basis we are planning. Basically weekly basis. Maybe sometimes we will be giving regular speech language therapy daily. That means 7 days the child has to attend for speech therapy. And sometimes we will be giving sensory integration therapy for regularly and speech therapy 3 days in a week. Maybe behavior therapy regularly, like that, based on the complications or based on the priority of problems to be handled, we will be planning the frequency of therapy. Frequency in the sense the problem is the cause for frequency selection. So that is how we are planning about the multidisciplinary therapeutic intervention, like combination as well as frequency is very much important. This is only can do by a senior professionals. It is because, discussing with all the professionals, somebody should coordinate the facility. Somebody should discuss with all the team members, and everybody's concern should be considered, and the planning should be based on their advice. This is not a single person action. Actually, it's a combination. It's a teamwork here. Not like a person is deciding the therapy. Is not like that. We are based on others' discussion. Like a speech pathologist is a different professional, psychologist another professional, sensory integration therapist is another professional. We have to. One person should be there for coordinating all these things, and that person must listen to other professionals, and their suggestions should consider. And finally, we have to come to a conclusion with the therapeutic planning. That means it's a vast planning is required. Simply, we can't say the management plan. It is required, like a professional teamwork is required there. That is what.
Thank you, Mr. That was a very detailed explanation. You spoke about in the planning stage. You spoke about combination of therapy and also frequency, whether it has to be done weekly, monthly. You spoke about speech therapy, behavior therapy, and what are the different types of professional speech pathologists, a psychologist, and various people come under form a team, and then under one head you decide these are the different therapies that needs to be given. So I'm just going back to
exactly.
the question that I asked Dr. Mursad. I'm going to summarize, doctor. I asked this question: how long will it take for treatment? You said it can take 2 to 3 years, and you said something very interesting. It really kind of caught my attention. You said parents should treat this as a gift, an opportunity to correct their bad karmas, right? That was a fantastic thing that you said. You also said that if they look at this opportunity to look after the child and create positive energy in the home, then the chances are the child, the patient, whoever, will get treated much faster. That was a very different perspective that I heard, that I have not heard this from anybody else. Doctor, we have like 6 minutes before we can close. I have one last question. Would you suggest to parents or guardians, what would you suggest to parents or guardians to keep the patients to resolve strong and to care for themselves too as the treatment continues?
For that purpose, first thing what I advise is make your mind calm and quiet first. In the sense, be stable in your decision. How you can be stable? Only with having Satwik kind of mind in your, or you have to take proper decision at proper time. Because many a time I used to say about one example, in Hyderabad, I had a patient, father was leading neurosurgeon in Hyderabad itself. Mother is a gynecologist. The kid is around 12 years of age. Till that 12 years of age, they were wandering here and there to have a better treatment. They are not lagging in education. They are professionals, medical professionals, but they are not getting proper line of treatment. What is lagging in that? Because we have to see that somebody is driving, some cosmic energy is driving within us to go to the proper space or to get the proper treatment. So better keep that sattvic nature of mind with proper food. Only with food. I am not saying anything else. You can just follow the food habits first. Make your mind sattvic so that your thoughts will be having much clarity in that. Once you take the decision, just go ahead. Don't go here and there and take many, because you will get n number of advices from many places. Whichever, even you go for Ayurveda, go for allopathy, go for homeopathy, whatever it may be, just firm your decision first. To get the firm decision, your mind should be properly, the focusing should be there. So just pray God and go ahead with the basic line of thing, that is ahara. And don't blame each other. Actually, we are seeing many parents blaming each other. Father will blame mother, mother will blame father. You are not seeing, you are not, you are busy with your job. Just don't take care of all those things. Your ultimate aim should be taking care of your kid. What better should be given for the kid, so that the outcome will be 100%, the outcome will be there. So put your effort to that. That's why I told about karma, that example I told. Unless until we face difficulty, that maybe either with the whatever the diet restrictions, what I am saying, that also facing some difficulty, maybe economically, maybe some surroundings you are making it difficult, whatever difficulty that you are facing, think that you are studying something or you are diluting your karma. So that kid is the main cause for diluting your karma. That is what I told, spiritual thoughts, not religious thoughts. That thought should be there in your mind. Keep that this kid is precious for you as well as for the society. We will bring up in the mainstream. We are here to help you. We all these things combined together. We are right now proud to say that we are the rare institution in the private firm that's giving all these kind of facilities, and that too only with the grace of God. Because we are, since 700 years we are doing the treatment, not the autism related treatment. These are the treatments within 15 years came up. Before that also we are doing the treatments. But right now our surroundings are also healing. Our homely atmosphere is healing the kid. It's not like staying in a concrete building we can treat the kid. It's impossible. So that atmosphere is also needed. And after that, taking care of whatever the advices that we are giving, you should follow the advices. That also needs some grace. Otherwise you will leave in between. That also I am having examples. After getting the treatment, the parents are saying that all other kids are taking chocolates. Why my kid is not able to take chocolate? I will give chocolate. I told, yes, you give. But after 4 years, that same parent has came again and saying that, sorry doctor, that time I thought of giving whatever he need was needed at that moment. But right now I came to know that it's not the thing, not giving the things whatever he needed, but giving the things what he need, in the sense what need for the help, and we need a long-term result. That's what we need. So be firm and be positive always. We all are here to help you. Don't worry.
Doctor, amazing response. You said this is an advice to the parents. You said stay calm, adopt a sattvic nature, and especially you spoke about the food, and don't blame each other. Yeah. So that was an important thing that you said. You again re-emphasize the fact that keep the kid as that you do in your life. Pay attention, because you also said this before. Look at this as an opportunity that has come to you to correct your own karmas. One important thing that you said is, don't give what the kid needs, give what is needed for the kid. And that was a fantastic statement that you made. Doctor, one question which has come from the viewer, I want to ask you this. The question is, because you spoke about the gut, which is the primary reason for the ASD, the person is asking, is it related to gut leaky syndrome? I don't know whether you understood the question. So the question, I'm reading it as it is.
Yes.
Are you saying is leaky gut syndrome? That's the question.
Leaky gut syndrome is one of the defectiveness or defect happened, whatever I have told about gut metabolism. In that gut metabolism, leaky syndrome also will be included, because many will complain about gut leaky syndrome. You don't want to make heat in your head while hearing gut leaky syndrome. Why? Because the proper digestion of food is not happening. That is going to the intestine without having digestion and assimilation that is going through your intestine. So that has to be corrected. That is one of the correction needed for gut metabolism.
Thank you, doctor. It's exactly 6 o'clock. Thank you so much for your time. Thank you, Mr. Danesh. Thank you for I learned personally. I have learned so much from today's discussion. I look forward to host you once again, maybe in a couple of months, and we will give more information for our viewers, and let all these people who are with us in the live stream benefit from the services that you are providing. Thank you very much. God bless you, doctor.
Namaste.
Thank you so
Namaste.
much.
Namaste.
Thank you so much. Thank you. Thank you.